Hi, my name is Jody Gray, and I am one of the directors of patient services here at URMHC Home Care. Before we proceed, I would like to introduce the actors in the video. Amy Steed and Joshua Fallon are both physical therapists and work out of the Rochester office. On behalf of the Patient Experience Committee, I would like to thank both of them for the time they have spent putting this video together, as well as the commitment they have shown to the overall objectives. So thank you, Amy and Josh. Early in 2017, the Patient Experience Committee identified a performance improvement opportunity related to patient satisfaction. Specifically, it was identified that there was opportunity for improvement related to 3 questions that are asked in the Patient Satisfaction Survey, better known as the HCAHPS, that patients in the certified agency fill out. These 3 questions are: do you feel that you have been treated with courtesy and respect? Do you feel that you have been listened to? And do you feel that you have been treated gently? If you recall, we did a short survey asking what you felt might be barriers to patients having a positive home care experience as it related to these 3 areas. We also asked you what you felt might be some solutions to these barriers. We received terrific feedback, and we were able to identify some common themes. We have tried to incorporate some of those suggestions as well as modeling best practice in this video. It is the hope that you will come away with some ideas or thoughts about where you might have opportunities for improvement in your own practice that would enhance the overall experience that patients have with our home care. Our goal is to have our patients answer always when asked those 3 questions. Notice how Amy is repeating the words courtesy and respect and listened to, and references the pledge we make to our patients. If you haven't had the opportunity to read the Visiting Nurse Pledge to our patients and families that is in the patient information booklet, I would encourage you to do so. It specifically identifies the 3 areas that we are trying to address. In addition, we also feel that using the specific words may be something that patients remember when answering the patient satisfaction survey, and because they have had such a wonderful experience, will of course answer always to the questions.
Hi, Mr. Fallon. I'm Amy, the physical therapist. I spoke with you last night regarding your visit today.
Right, you're right on time.
I want to be respectful of your time, so I'll try to be prompt. Okay.
Sounds good.
So before we get started, I want to give you the home care folder, okay? And I want to reference some values that our agency and myself feel are important to uphold during our visits. We can reference those in the patient information booklet. And those values being that you're treated gently with courtesy and respect, and that you're listened to. Okay, so if you have any concerns during our visits related to that, please let me know.
Sounds good.
Okay. Your doctor's referred physical therapy to help you recover from your knee surgery today. Tell me how you're feeling.
I'm a bit sore, but managing.
One of the consistent comments that we received when we asked you to identify barriers to patients feeling listened to and being treated with respect was using the laptop in the home. Notice that Amy is able to explain why we use the laptop, as well as how to incorporate it so that it isn't perceived as a barrier, both by her explanations to the patient, as well as in how she positions her body, facing the patient more directly, with the laptop more to the side.
I'm going to go ahead and use the computer to sign into your visit.
Okay.
So I want to talk to you a little bit about the computer. It's a tool that we use to communicate information to other disciplines relative to your status today. We can also reference your past medical history. We can take a look at your doctor's orders. We can take a look at your medication list.
Right.
Okay. So it's important that I jot a few notes throughout our visit. Is that okay with you?
Yep, that sounds good.
Okay, it gives me a really good, adequate picture of what it looks like today.
Okay.
Okay. All right. I'm going to be asking you a few basic questions. They're going to be related to pain, medications, falls, doctor's visits. Those will be asked every single time I come.
Okay.
Okay?
Sounds good.
So I'm going to start off today asking about your pain. Can you tell me a little bit about how your right knee is feeling today?
Yeah, it's definitely aching and giving me some trouble getting around, but it's not stopping me completely.
Another way that Amy tries to demonstrate courtesy and respect, as well as being listened to, is to ask the patient what his goals for care are. This says to the patient, "It is important to us to include you in your plan of care, and we value your input as we move forward."
So, Josh, I want you to be a part of the plan of care today. And so could you give me some ideas about the goals that you'd like to achieve in physical therapy?
Yeah, actually, to get more independence back at home would be great, first and foremost, but secondarily there's a tournament in soccer in a few months that I'd like to be a part of,
Okay.
if that's possible.
All right. Okay. In just a few minutes, I'm going to take your blood pressure and then I'm going to close the computer
Okay.
and we'll get on with your assessment.
Sounds
Would that be okay?
good. Mm-hmm.
All right.
Not only was Amy able to incorporate the laptop effectively and efficiently into the visit, but she was also able to set the stage for other members of the team when it comes to their having to use the laptop as well.
Okay, Josh, I'm going to lift this arm up a little bit. Oh, I'm sorry. Can you tell me about that shoulder?
Yeah, it's an old rotator cuff work injury. Probably better to do this side.
Okay.
If you don't mind.
Yep, I'll try to be as gentle as I can. Can you let me know if this bothers you on this side?
This side's fine.
All right. Thank you.
In this past scene, Amy was attempting to demonstrate treating a patient gently. How we physically touch a patient may not be perceived as being gentle. It is important to ask patients how they are feeling, explain that you are not trying to hurt them, and adjust your approach to care if necessary. In addition, when we are in a rush and give the impression to the patient that we don't have the time to address their care needs, it may also be perceived that we are not treating them gently. The pace of the visit, including the patient, and making sure that we have addressed concerns may work in our favor when it comes to having patients answer always to this question on the survey. Again, using the actual word gentle may be a trigger for the patient when answering this question on the survey.
So we're finished with the assessment today, Josh. I'd like to recap and just review what I heard you say earlier. Okay. That your goals were to be independent, to get your strength back in that leg, and hopefully play that soccer tournament in a couple weeks.
That's right.
Is there anything else we haven't touched on today that you'd like to go over with me?
Yeah, actually, getting socks on has been a little bit difficult. My wife's been helping me put them on. Is there anything you can do to help me there?
Sure. I'm going to be calling your doctor today to let him know that we stopped by and started physical therapy. I will ask for an occupational therapy referral.
Okay.
They can bring some adaptive equipment that will allow you to put your sock on independently.
Okay, sounds good.
All right. I'm going to pull the computer out one more time just to jot a few notes to make sure I have an adequate picture of today. If you can find your calendar so we can schedule the next visit, we'll do that in just a minute. Okay. Let's go ahead and take a look at next week.
Sure.
How is Monday at 8 a.m.?
That works for me.
Okay, great. Monday, 8 o'clock.
Once again, Amy has demonstrated the key values by reflecting back to what the patient stated were his goals and by repeating the key words. She is leaving the patient with the impression that by her words and actions, she truly values treating the patient with courtesy and respect and listening to the patient.
Josh, I hope you felt you were treated with courtesy and respect today. Is there anything else I can do for you? I have the time.
It is important that the patient feels that we have the time to address anything else that the patient may bring up. Take just a minute before you put on your jacket, grab up your laptop bag, and head out the door to leave that lasting impression that you have the time. Let's just see if we can show the public what we already know, that we are the best home care agency in the area, and our patient satisfaction scores show that. Thank you.